October is National Breast Cancer Awareness Month, and as a tribute to survivors and fighters, Mount Pleasant Towne Centre and Roper St. Francis is holding their 5th annual Pink Promenade. Joining us with the details is Dr. Autumn Show, breast surgeon and registered nurse Nikki Techmeyer of Roper St. Francis Healthcare. Ladies, thank you for joining us today.
Thank you for having us.
Dr. Autumn, I will start with you. So you are a breast surgeon, and can you explain your approach to providing care for patients with breast cancer?
Yeah, so there's a lot of emotions that go into a new breast cancer diagnosis. So I think we really need to appreciate that when somebody comes in, there's already a high level of anxiety. So we just try to be a calming presence, and oftentimes a surgeon is the first person that somebody with a new breast cancer diagnosis meets. And so we try to remain calm and walk through the whole process. And hopefully when they leave that first appointment, they're feeling much better because we have a plan in place.
Absolutely. And now we are coming up on the 5th annual Pink Promenade. Can you ladies go into some details about that?
Well, it's a really fun event. I was there last year. It's beautiful. I think it's a really well done event. And of course, Nikki's going to be starring in the show. So it'll be so much fun. I really think it's a great event for survivors to really have a great support group, and it's just fun.
And it's not your regular event. You have a lot of fun stuff going on. Nikki, could you talk to some of that?
Right. You have not only the runway and showing off the fashions of the town center, but you're celebrating breast cancer and survival and the treatment process and coming out on the other side and all of the things that involves, and just celebrating yourself and those others who are recovering from breast cancer.
Yeah, and now speaking of the treatment research, this directly benefits Roper St. Francis, the breast center. Can you talk a little bit about what you guys do there?
So we really try to provide resources for any woman with breast cancer. There's a lot of different resources that somebody can need, whether it's a little bit of extra financial support. We have an oncology dietitian. We have a lot of different resources, and of course with those resources have to come funds, and so those funds are really helpful for women who are battling breast cancer.
And now, if you have family history of breast cancer, when would be a good time to start going and getting screenings?
So if you have a significant family history for breast cancer, I would recommend just making an appointment. We see people with family history all the time. We do a risk assessment, and we try to identify those high-risk patients. If you're identified as being at high risk, we generally are going to start screening even earlier than the average risk patient, which we would recommend at age 40. And so we can start as early as 10 years prior to the youngest relative diagnosed. So for some patients, that does mean they're starting screening much earlier than a typical woman would.
Okay, and now can you speak to any recent research or findings, if there's anything new that we need to know?
Yeah, earlier this year there were new guidelines put out by the USPSTF, which previously there's been a discrepancy on what age women should start getting screening mammograms. And while the majority of breast surgeons and people in the oncology field would recommend starting at age 40 and getting a screening mammogram once a year, the USPSTF guidelines, the one thing they did was drop their age from 50 to 40, but they still recommend every other year. And I really think the benefits definitely outweigh the risk of a mammogram. So I always want to advocate that women get a mammogram every year starting at age 40.
Every year, and also do self-checks?
Yep, so also our national guidelines are going to recommend doing a monthly self-breast exam. Knowing your own breast tissue is very helpful. If you know you're normal, then you'll know an abnormal finding, and that's when you can alert one of your healthcare providers.
Absolutely. And now, will this be something informational at the Pink Promenade? Will you guys be giving out, flyers, or will it be informal about,
Yeah, it's a little bit more informal, but we still like to be around. We kind of mingle with the crowd, and so of course if there's questions, we're happy to always answer those and be a source of information.
And Nikki, is this your first year starring?
It is.
It is, and hopefully not your last.
It's very exciting.
Yeah, what are your hopes for the future of Pink Promenade?
That it can reach more people. It's a very small event, but very cozy in that aspect. But there are a lot of people who suffer from breast cancer, and a lot of people who are affected, family members, caregivers, etc., that would benefit from seeing it celebrated.
Yeah, I feel like unfortunately we all know someone who has been impacted by breast cancer. So we really appreciate what you ladies are doing, and hoping to further the research and get closer to finding a cure. Pink Promenade, a special catwalk and cocktails, is happening Saturday, October 7th from 11 to 1 at Mount Pleasant Towne Centre. Tickets are $40. And Autumn, where can we purchase tickets?
At mountpleasanttowncenter.com.
Wonderful. Ladies, thank you so much.
Thank you.
Thank you.
We're back after this.